Have you ever felt a sudden pain in your knee while walking, squatting, or turning? Sometimes it comes with a clicking sound, or even worse, your knee feels like it's getting stuck. If that sounds familiar, you might be dealing with a meniscus tear, one of the most common knee injuries out there. In this video, I'll walk you through everything you need to know, in a simple and clear way. So first, let's understand what the meniscus actually is. Inside your knee, there are two small, C-shaped structures made of cartilage. These are called the menisci. Think of them like shock absorbers. They help distribute weight and keep your knee stable when you move. Without them, the bones in your knee would rub directly against each other, and that would cause serious damage over time. Each knee has two of them, one on the inner side, and one on the outer side. Now, a meniscus tear simply means that this cartilage gets damaged. Sometimes it happens suddenly, especially during sports. Other times, it develops slowly over the years as the tissue weakens. So, not all tears are the same. Some are caused by injury, and others by wear and tear. And actually, this is a very common problem. Meniscus tears are one of the leading reasons people visit orthopedic clinics and even undergo knee surgery. The risk becomes even higher if there's a ligament injury involved, especially an ACL, also known as the anterior cruciate ligament, tear. So why does this injury happen? There are two main reasons. The first one is trauma. This usually occurs during sports, especially when the foot is planted and the knee twists suddenly. The second is degeneration. As we age, the meniscus becomes weaker and more fragile, and at that point, even a simple movement, like standing up or squatting, can lead to a tear. Interestingly, the inner meniscus, also known as the medial meniscus, is more commonly affected. But in acute anterior cruciate ligament injuries, the outer meniscus, also known as the lateral meniscus, tends to be involved more often. Not all meniscus tears look the same. Some are small and stable, while others can move and cause more serious problems. For example, vertical tears are quite common in athletes and are often repairable. Then there are bucket handle tears. These are larger and can actually flip into the joint, sometimes causing the knee to lock. Radial tears disrupt the structure of the meniscus completely, which affects how it functions. In older patients, we often see horizontal tears, and these can sometimes be associated with cysts. And finally, root tears are especially important, because they behave almost like the meniscus is no longer there, which can lead to early arthritis. So how do you know if you might have a meniscus tear? The most common symptom is pain, usually on the inner or outer side of the knee. You might also notice clicking or popping sounds when you move. Some people describe a locking sensation, like the knee gets stuck and won't move properly. Swelling can also happen, and it may come and go over time. And in some cases, you may feel like your knee isn't as stable as it used to be. When you visit a doctor, the diagnosis often starts with a physical exam. One of the most important findings is tenderness along the joint line. There are also specific tests that help us evaluate the meniscus. For example, the McMurray test, where the knee is bent and rotated to check for pain or clicking. Another one is the Thessaly test, which involves standing and gently twisting the knee. If these movements reproduce your symptoms, it increases the suspicion of a meniscus tear. To confirm the diagnosis, imaging is usually needed. X-rays are often normal, especially in younger patients, because they don't show soft tissues like the meniscus. That's where MRI comes in. MRI is the most sensitive test we have for detecting meniscus tears. It allows us to see the structure clearly, especially when the tear reaches the surface of the meniscus. That said, MRI is not perfect. Sometimes it shows findings that don't actually cause symptoms. So it always needs to be interpreted together with the clinical exam. So, how do we treat a meniscus tear? Well, it really depends on the individual. We look at things like your age, how active you are, the type of tear, and how much it's affecting your daily life. In many cases, surgery isn't necessary. With rest, proper exercises, and physical therapy, a lot of people improve and return to their normal activities. But if the pain continues, or if there are symptoms like locking or significant limitation, then surgery might be the better option. These days, most procedures are done arthroscopically, using small incisions and specialized instruments. And whenever possible, we try to repair the meniscus instead of removing it, because preserving it is important for long-term knee health. The good news is that meniscus tears are treatable. With the right approach, most people can go back to their normal lives without long-term problems. The key is not to ignore persistent knee pain. Getting an early diagnosis and proper treatment can make a big difference in the long run. If you found this video helpful, don't forget to like and subscribe. And I'll see you in the next video.